Hi, I'm Jaclyn.
And I'm Courtney, and this is Caffeinated Crimes.
Welcome back. Every week I try to think of something different to say, and that's just what comes out my mouth every single time. I don't know why. I'm sorry. I hope you guys don't hate it. If you have something better to say, let me know, because I'll switch it up, but in the moment, nothing else comes out. So just welcome back, guys. And
do you remember that one time when we were like, we're going to tell a corny joke at the beginning of each episode, and I told the joke wrong, like I didn't get the punchline, and then we never did it again.
We should do that again next week.
Just give it a try. Did you guys like it when I completely messed up a simple joke? Because I'll do it again.
I mean, Courtney's like, I'll mess up all the simple jokes for you guys, and just let us know how you like that. And earlier I was working on editing last week's episode where we talk about Courtney having no internet and having a new chair, and guess what? This week, guys, Courtney still has no internet and has another new chair. So,
yeah.
It's like deja vu.
It's like I'm just repeating everything. I feel like Rose in Titanic with my internet.
Yes.
Like, it's been 84 years since I've had internet. But yeah, my chair, it was a little weird when we were putting it together. And we were like, are we just stupid? Are we stupid? Do we not understand how putting together a basic chair works?
I feel like that every time I put something together, so.
Well, and this chair too, clearly a machine made it, and the holes in the leather don't line up with the screw holes. And I'm like, you can't make this better. But basically I was leaning to the right severely. It was kind of like I was on a hill. So I was like, no, I paid a lot of money for this chair. I'm going to have a chair that works.
Yes.
So we took it back, and literally they were like, okay, whatever, here's a new one. Didn't even look at it.
I believe you. Just take it. It's fine.
We put it together. It was a lot easier, a lot smoother.
That's good.
And now I have a new chair. And I should have internet tomorrow, but
yes,
to be determined. And I think I said that
sure.
last week, too.
It's just an ongoing drama of Courtney's internet or no internet, or...
You would think, in this day and age, it would not be that hard to get internet.
You would think, but apparently it is. I mean, maybe when last week's episode comes out, we can do an Instagram poll and ask if you guys think Courtney has internet yet. So...
Oh my gosh, yes. We have to do that.
That'll be 3 weeks from now. I'm not completely sure it's going to be a yes, so...
Yeah, it was so funny because we were like, okay, it was a week and a half ago, I think, at this point, and we were like, okay, it's our last day going to my parents for internet. And then it was like, just kidding, guys, we're back for another week.
Next morning, 8:30, boom, boom, boom. Hey, guys, it's me again.
Well, my mom and my sister have both been like, I don't know, we're going to kind of miss you when you go back. We've kind of liked having you around.
I was wondering that, too, especially with your niece and nephew. I'm like, oh, are they going to, be like, oh, wait a minute, where did Aunt Courtney go?
Eli's really going to miss me, and I'm really going to miss Eli.
Yeah, that's going to be rough. Maybe you'll have to, plan a couple of work days a week over there.
Yeah, because, usually he has, a little playpen downstairs where they just, take him down, if my mom's out or whatever. But he's been like, no, stay upstairs, stay with Crody. And so he'll just sit and, watch his little, Blaze and the Monster machines. And he'll just sit there and be, pointing out things to me. And he'll, count along. It's, so cute. He knows so much. It's so cute.
He's adorable and so smart.
Oh, what a cutie. I got nothing else.
All right. That's all I got. All right.
Although I will say, so this week's episode is another Canadian episode.
Yes.
Which I realized we're really on the Canada train. And please don't ask my Canadian geography, because I'm trying to think of how close these last two have happened, and no clue. I know where Alberta is. I think. I know where Calgary is because of hockey.
I know that Vancouver's on the west coast. That's about it.
Yeah, Calgary is near Vancouver, and a Canadian near Vancouver, where it's actually 400 miles away, but it's close. Pretty sure. I don't know. We'll I'm not gonna look at it. No. Sorry, guys. I was gonna lie to you and say I was gonna look it up, but
it's probably
I'm not
going
to.
Happen.
Just tell me. Just send us.
Yes,
send us an
for
email.
Sure.
And so This episode was recommended by our patron Sierra, who does live in this area in Canada. So thank you, Sierra, for this recommendation, and thank you for providing us with a lot of good resources for this episode. It was greatly appreciated.
Yes, absolutely. It was a huge help, and thank you so much for giving us suggestions. In case you guys don't know, we love suggestions. Obviously, we want to do the cases that you guys want to hear about, so definitely send us your suggestions, and thank you, Sierra, for doing so.
Yeah, my mom keeps talking about how badly she wants us to do Chris Watts. So we're going to have to, try and plan that one, because she's like, I want to hear you guys talk about it. So maybe that'll come someday. But, and yeah, maybe one day soon, I've been thinking about it, putting up an Instagram story where you guys can give us some suggestions, like real time, just to kind of see. You know, we love them. There's a lot of cases out there. It's hard to get them all. So, but our resources for this episode is a Global News Canada article, the Mayo Clinic website, Ezekiel's medical records, WebMD, Journal of Ethics, the Huffington Post Canada article, and a CBC Canada article, and court documents as well. So, Ezekiel Stephan was only 19 months old when he tragically died from meningitis in 2012. His parents, David and Colette, were charged with failing to provide the necessaries of life to their son. On March 13, 2012, the Stephans made a frantic 911 call after Ezekiel stopped breathing at their home. He was taken to a hospital in Cardston and later transferred to Alberta Children's Hospital in Calgary. He had little brain activity and died a few days later. So as you can tell, maybe a little bit of trigger warning if you have a young child or children. This is a child death. It's not as brutal as some of them are, but it is a child dying.
Yes.
So 28-year-old David worked in sales and marketing at Empower Plus Micronutrient Treatment. It was his family's business. And 31-year-old Colette had previously worked there, but she did become a stay-at-home mom 4 years before when their oldest son, Ezra, was born. So Colette was 20 weeks pregnant with their third child at the time of Ezekiel's death. And Colette never saw a doctor throughout any of her pregnancies. She was just wilding it there. little house on the prairie style, I guess. Her vitals were monitored by her friend who was an RN and also her birth assistant. And Ezekiel was checked by the RN for the first few weeks of his life, but never saw a physician. So clearly he never had any vaccines as well, just to kind of throw that out there.
Yes. No actual medical care other than the nurse friend coming to the home and laying eyes on him, basically.
Being like, 10 fingers, 10 toes, looks good to me.
Breathing, all right, cool. Yeah.
It's a baby. Surprise. It's a boy. So, Colette and David were both interviewed by RCMP after Ezekiel's death. So, Colette said that Ezekiel had started wheezing 2 weeks earlier on a trip to Lethbridge. So, she researched his symptoms and was like, oh, it's probably just the croup or the flu, maybe some whooping cough. So they treated him with some home remedies that included hot peppers, garlic, onions, and horseradish. Ew. Like, just kind of ew. As a full-grown adult, ew.
Doesn't sound very appetizing.
Yeah. So the Stephans also asked a friend who was a registered nurse to come over and look at Ezekiel. So she did mention it looked like he was possibly showing signs of meningitis. So they went to a holistic doctor in Lethbridge. And both parents did believe Ezekiel was improving until the day he stopped breathing. So, as I did in a previous episode, I researched in WebMD and Mayo Clinic about meningitis. So, good.
Yes, because I feel like that is really important to this case to know some of the details of the illness.
And I think it was something for me too where, like, I know what it is, but do I really know what it is?
Yeah.
You know what I mean? Like, you know what it is, but you're like, I've never really thought much more about it, I guess. Mm-hmm. So, meningitis is an inflammation of the fluid and membranes, or meninges, surrounding your brain and spinal cord. So, the swelling from meningitis usually triggers symptoms such as a headache, a fever, and a stiff neck. So, I found most cases in the U.S., I couldn't really find Canada, but U.S. are caused by a viral infection. but bacterial, parasital, and fungal infections can be other causes. So you can have like viral meningitis, bacterial meningitis, etc., etc. And some cases do improve without treatment, but some do require emergency antibiotic treatment. So early symptoms do mimic the flu, and they may develop over a few hours or a few days. And symptoms and signs in children under 2 include a sudden high fever, a stiff neck, a severe headache that seems a little different than normal, headache with nausea and vomiting, confusion or difficulty concentrating, seizures, sleepiness or difficult waking, sensitivity to light, no appetite or thirst, and a skin rash, which I feel like is also hard to tell in children under 2 because they can't really be like, hey, my head hurts. You know, like, my headache feels different than normal. Like, can't really communicate that well.
Kind of tough symptoms, you know, especially with like sleepiness and difficulty waking. And, you know, children do those things, I mean, 1, all the time, but 2, if they have a cold or the flu or whatever, especially so. So it is kind of complicated at that age.
Yeah, and I feel like nausea is something more you feel rather than can detect. And vomiting, I mean, kids kind of spit up, throw up a lot.
Exactly.
They usually do recommend immediate medical care because bacterial meningitis is very severe and life-threatening without antibiotics. And delayed treatment can also increase the risk of permanent brain damage and death.
And if I could also add one thing that I learned about meningitis that I did not know, that will come up later in the trial. Apparently, like, coming and going of symptoms is very common. So like some illnesses, it's like you start out sick and you just get sicker and sicker and sicker, but meningitis is one of those that, like, you may be really sick for a couple of days and then you may get a little bit better and then you get sick again. So that is very common with meningitis.
And it's also believed Ezekiel likely died of either bacterial or viral meningitis. So I'm just going to give a background on those. The Mayo Clinic website does like a great deep dive on like the parasital and the fungal one, but I'm not going to get into that because it's a lot. So
yeah,
we're not a disease podcast. If you would like that, go to This Podcast Will Kill You.
Yes.
This is not an ad. I wish it was. Anyway, so bacterial meningitis is when a bacteria enters the bloodstream and travels to the brain and spinal cord, causing acute bacterial meningitis. And it can also occur when the bacteria directly invade the meninges. So this can happen from an ear or sinus infection, a skull fracture, or even sometimes rarely like some surgeries you might have. There's quite a few strands of bacteria that can cause this, but again, I'm not going to go too much into it because 1, I'm going to pronounce them all wrong, and 2, I'll probably confuse you because I'll probably be reading word for word from the Mayo Clinic website and not understand what I'm saying.
Makes sense. So,
if you want to do a good deep dive, please go to the Mayo Clinic website. It's awesome. They explain it all. So viral meningitis is usually mild and often clears on its own. So most cases, again, in the U.S. are during the late summer and early fall, and viruses such as herpes simple virus, HIV, mumps virus, the West Nile virus, and others can cause viral meningitis. And so, a few risk factors for meningitis include skipping vaccinations, which I mentioned. You did not have any.
Check.
Check. Age. Viral cases are more likely in children under 5. Bacterial is more common just in those under 20 in general, so check. And living in a community setting, so that's like dorms, military bases, like boarding schools, stuff like that, where you're just like constantly around people, basically. Pregnancy, and a compromised immune system, so that's like if you have AIDS, if you have alcoholism, if you have diabetes, etc. There are vaccines available for some forms of the bacterial meningitis, and most of those are recommended for young children as young as 2 months.
And I did tell Courtney about this when we were doing the research for this episode. But as a child, I had this irrational fear of meningitis because of the vaccine commercials. Because you would see these kids like outside playing, and then you would see their parents talking, and they're like, they were fine one day and they were dead the next. So anytime after that, if I would have like a slight headache, and if I slept funny, so like my neck was stiff, I was like, oh my God, it's meningitis, I'm gonna die. So I just had this irrational fear of meningitis for a long time, thanks to those commercials, so.
Yeah, I do remember those commercials, like when you brought them up, because it was always like a football player.
Yeah.
He's like playing football and like the quarterback and throwing it, and the next day he's like on an incubator.
And there's like that sad music, and yeah.
I'm like, I was planning his senior year, and now I'm planning his funeral.
Yes.
And I was like, Jesus, it's a little too deep.
Exactly.
I was just trying to watch Cat Dog here. Come on.
Story of my life, man.
Okay, so now that I've given kind of a little bit of a deep dive on meningitis, you know some signs and symptoms, and so now I'm going to talk about the 2 weeks leading up to Ezekiel's death. So this is in the physician's report based on assessment of Ezekiel and information from Colette. A lot of it is information from her. So Colette says Ezekiel was perfectly healthy until February 27th when he developed a fever. Initially, they believed he was just teething, and then later in the day, he developed like whistling, wheezing breathing, and just seemed to have like increased difficulty breathing. So, like you do, you just phone a friend. It's your first thought, right?
Right.
Just kidding. But she was a registered nurse and their birth assistant, so she did have a little bit of background. But over the phone, the friend could hear Ezekiel's breathing and was like, maybe it's the group. Maybe. But Ezekiel didn't really have a cough, a runny nose, or congestion at the time, but he did have a decreased appetite starting later that day. So Colette looked up croup and noticed that it was a viral infection and only medically treated with steroids if severe. So she's like, you know what? It's fine. We're just going to treat his breathing difficulties with some cool air and a humidifier. And they also started him on some like homemade remedies, which they believed would fight off infection. And was something they'd even given Ezekiel before when he had a cold, that they thought really helped. So it included oil leaf extract, garlic, and I'm going to butcher this, methyl sulfonylmethane, or MSM. So it's like a chemical that's found in like green plants, animals, humans. It's used for various treatments, but there's also no medical support that it actually works. So this was in addition to a daily smoothie given by his parents that included various nutrients mixed with fruit and frozen berries. So it's just like this little smoothie they gave him, and they just threw that in with it.
And the nutrients they gave him were from their family-owned business of nutrients. Just throwing that out there.
Which I would really like to see the trial runs on those to see how the long-term effects. But so Ezekiel's croup symptoms continued over the next week, even though he never had a cough. Which I think if you have the croup, you're gonna have a cough.
It's usually the most distinct symptom, yes.
And he continued to have a decreased appetite with minimal food intake over the week. He was only interested in drinking really small amounts of water, and Colette and David were using an eyedropper to make sure he was getting enough fluids in his daily smoothie. There were no changes in his urine or poop. That was all normal. After the first day of illness, his fever never returned. His skin frequently felt hot, but he was never too sweaty or shaky, but his temperature never went higher than 38.7 Celsius or 100-ish degrees Fahrenheit.
Which isn't very high.
Yeah. So he had very low energy, and he just wasn't in the mood to play. He mostly just watched TV and cuddled with Colette. And Ezekiel continued to have difficulty breathing, especially at night. It was the worst at night. But overall, his parents just believed he was gradually improving and responding to the home remedies. So by March 5th, Ezekiel seemed to be better. His breathing was better. His energy levels weren't back to like fully normal, but he was able to attend a preschool program with Colette that he had attended before he was sick. And he played a bit during the day, and he had a little bit of an appetite. And so at this point, Colette's like, okay, we don't have to keep giving him that olive leaf extract, garlic, and MSM. We can just cut that out. So the next day, March 6th, Ezekiel was very lethargic, more so than any of the days prior. So he laid in bed the entire day, and his only response was to moan unhappily when Colette left the room. So Colette resumed his supplements, and she also noticed an unusual neurological symptom that day where he'd pull at his diaper or rub his cheek. And Colette said to her they seemed unusual and involuntary. And she just wondered if these symptoms were due to the lack of food he'd eaten the previous week. Like maybe he was just dehydrated, hungry, whatever.
Mm-hmm.
So on March 7th, Ezekiel seemed better again. His abnormal movements had stopped, and he seemed less lethargic. He was still very far from playful, but at least he could watch TV at this point. And just want to point out at this point, these are all like kind of severe symptoms for them to be happening.
Mm-hmm.
And they never reached out to any doctor. They'd only at this point reached out to their friend who was an RN who believed it could be the croup. So they were just like, my kid is laying in his crib all day and will not make any movement except to moan when I leave, and didn't reach out to a doctor, which I find weird. I'm not a parent, but I feel like if my baby was just like, no, I'd freak out, to be honest. Like,
for over a week at this point. I mean, this isn't like one day where you're like, oh, okay, like let's just wait and see what happened. No, this has been like a week of this.
Yeah, and just in general too, like I feel like if my baby was having difficulty breathing and just seemed sad, I would just, anything I could do to make them better, I would do.
Mm-hmm.
Again, not a parent. But, so, from March 8th to 10th, he did seem to gradually improve and regain a bit of an appetite. He still really wasn't playful or active, and again, due to his improvement, Colette stopped the herbal remedies. And then on March 11th, his symptoms worsened again. He would not eat or drink, he was very lethargic, and now he was very stiff. So, these symptoms persisted on March 12th, and he was so stiff that his back was arched.
Which, this is a very specific symptom. I mean,
yeah,
that's not common as with, oh, okay, if you're having difficulty breathing, it could be from something respiratory wise. A stiff back is very not normal and very specific.
And especially it was arched, it was
yeah,
noticeable. Now, at this point, they finally reach out to their family friend, birth attendant again. So she came over to examine Ezekiel by checking his vitals and listening to him with a stethoscope. According to Colette, the friend determined his symptoms could be from meningitis. So Colette looked it up on the internet and even specifically mentioned the WebMD website. She came across the Koenig and Brudzinski's. I should have looked this up before I recorded. Sorry, guys. Brudzinski's, that sounds right. Test for meningitis, and tried them on Ezekiel. So the Koenig's test is to lay the patient supine or on their back with their hips and knees flexed, and then extend the leg passively. So the test is positive if it causes pain. So as you can think, if you're on your back with your knees kind of up, if you move your leg, you really shouldn't be feeling pain with that. So if you do, that is a positive test for meningitis. The Brudzinski's test is positive when, again, the patient is supine and when passively, moving forward the neck causes the patient to involuntarily raise his knees or hip inflection. So you're laying on your back, you move your head forward, and suddenly your knees are coming up.
And that's not normal either.
No, it's not. And Colette says these tests were overwhelmingly positive. There was no doubt in her mind both these tests were positive. So she's like, okay, you know what? I think Ezekiel has meningitis. And somehow, even though she did a little deep dive, she still thought, no, that's okay. I think it's viral meningitis. He only had a fever the first day. So let's just resume the herbal treatments and not see a doctor. So they made sure to keep giving him fluids with an eyedropper, as he would not drink on his own at this point, and started him on Total Reload, which is an electrolyte and amino acid supplement. Again, he was only, 19 months? I don't know if this is approved for children at that age.
Probably not.
Assuming not. And so within 2 hours, they believed he was feeling a bit better, a little less lethargic. So they called their naturopath in Lethbridge to ask for recommendations for treating viral meningitis and were advised to start him on something called Blast. So Colette says that during the week, Ezekiel remained afebrile with no return of difficulty breathing. He had no cough, congestion, vomiting, or diarrhea. He was having bowel movements less frequently, but he was still peeing a few times a day, but also if he's not eating, it's kind of natural, you're going to poop less. No one else in the family or anyone Ezekiel was in contact with became sick during this time.
Yes, and then on March 13th, the family decided to drive to Lethbridge to do some errands, which included picking up the Blast from their naturopath. And when they were there, they told the staff at the naturopath office that they needed something to boost Ezekiel's immune system because he had meningitis, and they told her that Ezekiel should see a medical doctor. So if your naturopath is telling you, hey, you should go see like a medical physician, maybe you should consider that.
Maybe do it.
So Ezekiel did seem more alert, but his back was so stiff that he could not be placed in his car seat. So instead, they put his crib mattress in the back of the car and they laid him on that for the drive.
Again, I'm not a parent, and I know that you do not do this.
No.
That is not safe. That is not safe at all. I don't care if you're sitting back there with him. If you wreck, your kid's gonna be dead.
Yes. Your 19-month-old should never be in a moving vehicle, not properly in a car seat. And if your child cannot physically get into a car seat, something is very wrong and they need an ambulance to get them to the hospital.
Yes, please call 911.
Or whatever Canada's... Is Canada still 911? I think it is.
I think all of North America... Well, because they called it the 911 calls, but I don't know if that was, like, Americanized.
Yeah. I don't know. Well,
I think all of North America is 911.
Okay. I know in some places it's like 999. So, anyway. So they picked up the blast and they started him on that and then drove back home. And they did stop at a superstore on the way to go shopping. And by the way, there was a walk-in clinic in the superstore. So they had their child, who was too stiff that he couldn't go in his car seat, at a store that had a walk-in clinic, but they didn't go there to see a doctor.
And that's what was crazy to me is because, one, this was in 2012. There is plenty of medical advances.
Yes.
And also, they lived in a very populous area with, I'm sure, very good medical care. You know, it's not like they were like, okay, we live in the woods, like the nearest doctor's an hour and a half away. We don't really know what to do. Like, you're living in like a city. Like, you have plenty of resources at your fingertips, and you just didn't use any of them.
And it's not a matter of not being able to pay for it, because this is Canada, where they think their citizens should have health care. So,
yeah.
But David did stay in the back of the car with Ezekiel while Colette drove, and they said that
Lord,
he seemed...
I hope so. Baby's gonna be rolling around back there.
Somebody should be supervising him. Oh,
sorry.
It's not funny. Okay. They did say that he seemed less stiff and more responsive, and they continued to give him fluids. So once they got home, Ezekiel took a nap, and he seemed even more alert after that. So still far from his normal activity levels, but he was able to respond to his parents and engaged in sign language, which is how he frequently communicated with them. So he did have another nap and woke up around 8:30 p.m. So Colette said at this point he had abnormal breathing, and it seemed that he was gasping and struggling to breathe, followed by a pause in his breathing for a few seconds. So she would pat him on the back, but they did eventually call 911 for an ambulance. And he did cough up some mucus and then started breathing again. So they canceled the ambulance and said they would just drive him to the hospital themselves because it didn't seem like he was in immediate danger at this time. But at this point they are recognizing, okay, you need to go to the hospital even though you are currently breathing. But then they didn't leave for the hospital for 20 minutes after the first 911 call. So 20 minutes is a long time when your 1-year-old child is struggling to breathe and you call for an ambulance but then cancel it because you think it's better to just take him yourself. But then you wait 20 minutes to get into the car. That's the length of an episode of The Office, guys. That's 20 minutes.
Do you know what you can do in 20 minutes?
You can do a lot of things in 20 minutes.
You can cook chicken in the oven at a high temperature. It might still be a little raw, but you could.
You might not want to eat it, but you could cook it.
You could watch any of your favorite 30-minute sitcoms because once you take the commercials out, they're about 20 minutes.
Mm-hmm. You could take a nice long shower.
I don't know.
You could have a long time of sex. Yep.
A long time of sex. I don't know. There's a bunch of things you can do in 20 minutes.
Yeah.
And waiting to take your child to the hospital is not one of them. And I also want to point out, we probably have a lot of American listeners. I feel like if this was in America, if they were like, we're going to cancel that ambulance, I'd understand it more because of how expensive an ambulance is.
Yes.
But again, this is Canada with free healthcare. I'm pretty sure they had free healthcare at this point.
Mm-hmm.
You know, you're not going to have to pay for that ambulance ride.
Yeah.
You have literally no reason not to take the ambulance.
Yeah.
You're not going to get charged $10,000 for that 10-minute ambulance ride. Like,
exactly.
What? And again, like if it was my kid, even if it's going to be that expensive, whatever. If they're not breathing, even if they start breathing again, no, something's going on. Yeah. Like, no.
So within minutes of leaving for the hospital, Ezekiel did stop breathing again. So Colette gave him some rescue breaths, and they called 911 again, and they kept driving towards the hospital with the ambulance on the way to meet them. And they gave Ezekiel CPR for about 10 minutes while they were on the phone with 911, but he never resumed breathing, and his skin was blue when the ambulance arrived. And we are going to play the 911 call here. If this is something that you are uncomfortable with, skip ahead, I think about 7 or 8 minutes. It is pretty long, but we are going to play that here.
Hey, we're going to need the ambulance to meet us on Highway 2 north of Cardston. On Highway 2 north of Cardston? Highway 2 going north of Cardston, yes. Are you on the blood reserve? Not yet, but, yes I am. I'm going past the blood reserve. If you send dispatch one from Cardston, I'll meet them. I got my blinkers on. I'll be on Highway 2 before they get there. Okay, what am I sending an ambulance for? Baby, stop breathing. He's not choking. He's stopped breathing. Okay. He's completely lethargic. Need an ambulance now. Okay, just 1 sec. I gotta get some information, okay? Alright, so you're on Highway 2 by Cardston? I will be on Highway 2 in about 5 minutes. Okay, how far north of Cardston are you? I will be 17 kilometers north of Cardston when I hit Highway 2, and then I'm continuing on to Cardston, so wherever they meet me. I got my blinkers on. How old's the baby? The baby's 1.5 years old. Oh, okay. And is it a male or female? It's a male. Is he breathing like, is he awake right now? He's been in and out of consciousness because he's been sick for a little while here, so he's been getting a lot of rest, and he was fine up until about half an hour ago. All of a sudden, he stopped breathing. Is he breathing right now? My wife is resuscitating him or giving him CPR. So he stopped breathing? He stopped breathing. Okay. So he's not conscious then? No, he would not be conscious. Okay. All right, and we saw this baby. Your wife saw this happen to the baby? Did my wife see this happen to the baby? Yes. Yes, she saw this happen to the baby. Okay. All right, I'm sending an ambulance to help you now. The still line will say exactly what you're next, okay? So you said that you're doing CPR on the baby right now? My wife is doing CPR on the baby right now. Yeah. Okay. And he is flat on the back right now, is that correct? Is he flat on his back? Yes, he's flat on his back. Okay, there's nothing in the mouth at all? No food or vomit? I don't believe so. Okay, right now you're 17 miles north of Cardston? 17 kilometers north of Cardston. I will be in about 3 minutes. And then I'm continuing on towards Cardston. So wherever they need me, I'm the one that's going very fast with flashers on. Absolutely, I'll let them know that. What kind of vehicle are you in quickly? I'm in a Trailblazer, 2002 Trailblazer. Okay, I'm going to give you some more instructions for your wife there, okay? Can she hear me or can you communicate with her? I'll put you on speaker. Okay. Okay, so she's breathing. Can she feel or hear any breathing in his mouth right now?
No, but when I breathe into his mouth, he has a bunch of liquid, so it gargles.
Okay, so can you feel or hear any breathing right now?
No.
Okay. This is what I want you to do, okay? Place your hand on his forehead, the other hand under his neck, and tilt the head back. You have that airway open?
Yep.
And you can still not hear or feel any breathing?
Yep.
Okay. So this is what I want you to do, okay? I'm going to tell you to get mouth to mouth, like you were doing already, with his head carefully tilted back, pinch his nose closed.
Yep, that's what we'll do it.
And completely cover his mouth with your mouth, then blow 2 regular breaths into the lungs.
Yep, and then
About 1 second each. Okay, just make enough, just enough to make the chest rise with each breath, okay?
Yep.
Now, do you feel air going in and out?
Yes, I do, but he doesn't breathe after that.
Okay, I want you to just keep doing that, okay? Now I'm going to tell you how to do chest compression. Okay, we're going to do chest compressions on him. Can you hear me?
Yep, I do 5, right?
What I want you to do is you're going to push down 1.5 inches with only the heel of one hand touching your chest, okay?
Okay.
And you're going to pump the chest hard and fast 30 times, at least twice per second. And I want you to let the chest come up all the way between pumps, and then I want you to tell me when you're done, okay?
So I missed the last one?
Okay, so what we're going to do is we're going to pump the chest hard and fast 30 times.
Yep.
Okay, at least twice per second.
Sorry, did you say 40?
30 times, yeah.
Okay, 1,
1, 2, 3, 4, 5, 6, breaths like we instructed earlier, okay? So pinch his nose, place your mouth over his mouth, then blow 2 breaths into his mouth. 1 second each of full breath. And make sure you see the chest rising between each breath. And then 30 pumps. You're doing an excellent job. Dispatch are going to come as fast as they safely can to meet you guys on the highway, okay? Okay, so 2 breaths, 30 pumps, 2 breaths, 30 pumps. You're doing an excellent job.
So you can hear from the 911 call that David is driving and Colette is in the back with Ezekiel where she's giving him CPR at the instructions of the 911 operator. I don't know, David's demeanor to me is odd in this call. I don't know, I just feel like if I was on the way to the hospital with my 1-year-old child who was laying in the back seat, currently not breathing. My wife is giving him CPR and he just sounds so calm. He's like, I'm on this road, I'm at this place, I don't know. And I mean, we know that this isn't a case of murder. This obviously isn't something that, you know, he was covering up or anything like that. But it just seems very odd behavior to me that he doesn't seem overly concerned. And not to say that he should be hysterical, but I mean, like, his voice isn't shaking, like there's no, like, he's not struggling to get through his words or anything, just super calm and collected. I don't know.
And he does not work in, like, a medical profession. I mean, he does sell nutrients, but that is not the same thing. It's not like he's like an EMT or something.
Yeah.
And also, I mean, his kids have never seen doctors, so they've never obviously been sick. And it's not like this is common for him.
Yeah.
You know what I'm saying? Like, if you have a kid who's sick very often and you kind of know what happens, so you kind of know the drill a little bit more.
Yeah.
Yeah, it's kind of odd.
So at the Cardston ER, Ezekiel was intubated and CPR was resumed along with epinephrine and atropine, and he eventually did start breathing again. So he was then transported to the Lethbridge ER, where he was met by the Alberta Children's Hospital PICU transport team and was transferred to Calgary via helicopter. And the doctors here believed that he had bacterial meningitis and were treating him as such, but they were not able to confirm the diagnosis with a lumbar puncture as he was not stable enough to undergo the procedure. So Ezekiel did never regain consciousness and was evaluated by a neurologist and found to be brain dead. And Ezekiel did die on March 16th, 2012. So while being interviewed after Ezekiel's death, David told the RCMP, quote, "Everything turned for the worse within a short period of time." David also said that the time between finding out Ezekiel might have meningitis and meeting the paramedics was so short that they were doing the best for his condition and didn't realize how severe it was. David also said, quote, "If this comes into question whether or not it's a case of negligence or not, of course I'd say no. I would say it's completely the opposite. We've gone above and beyond. Nobody in their right mind would put their kid at risk." You know, I kind of feel like waiting 2 weeks to seek medical attention is kind of putting your kid at risk there, David.
Just a little bit. Yeah, maybe see a doctor. Like 4 people recommended to you.
Yeah.
I'd also like to point out at this point, you're probably going to hear a lot of reactions from me, and I want you to know that they're all natural because, as I've mentioned, I don't have Wi-Fi, and so Jaclyn is the best podcast co-host ever and took on the rest of the research for me since I couldn't do anything. So a lot of this is going to be natural reactions. So
yes,
don't think I'm acting because I'm not good at acting.
So 11 months after Ezekiel's death on February 14th, 2013, David and Jaclyn Stephan were charged with failing to provide the necessaries of life. So they finally went to trial in 2016, and the medical examiner who completed the autopsy testified that Ezekiel died from meningitis and an empyema of the lower right lung. I did look up a pronunciation for that, but I apologize if it's still wrong. I tried. An empyema is an accumulation of pus causing infection in the pleural space. So it's kind of like the same thing happens to pneumonia in the lungs, but this is outside of the lungs.
Gotcha.
So if you get this same thing with pneumonia, potentially you could cough it up, but if it's around the lungs, it has to be drained. Like, you can't physically cough that up. He also said that Ezekiel's brain was covered in pus and swollen to the point where it could not have been functioning. He said he believed that Ezekiel also had an upper respiratory infection and agreed that meningitis is hard to diagnose. And the emergency responders testified that when the ambulance reached the Stephans, Ezekiel had no pulse or blood pressure, his heart rate was 0, and his respiratory rate was 0 when the ambulance reached him. They performed CPR for the 8 minutes it took to get to the hospital, but they were unable to secure an airway until just before they arrived at the hospital. And the reason for this is because the ambulance did not have any endotracheal equipment, which may have prevented them from being able to secure the airway. And so I guess they have different size equipment, and they didn't have the size equipment in the ambulance that a child Ezekiel's size would need. And I guess one of the EMTs had previously fought to try to get this equipment on the ambulance because they used to have it and then they took it out for some reason. Like, it wasn't like they ran out. It was just that they didn't stock it anymore for some reason. But crazy, a week later, they have all this equipment in the ambulance there. So
funny how that works.
Yep. So when asked if this could have contributed to his death, the medical examiner said that he believed Ezekiel was brain dead by the time the ambulance arrived. And a doctor from the Alberta Children's Hospital testified that the lack of oxygen to the brain could have been caused by meningitis or cardiac arrest or some other reason. So they're like, we don't know if this 8 minutes in the ambulance without oxygen contributed to his death in any way, or if basically he was already brain dead.
Which makes me think, too, if you had left for the hospital immediately or brought the ambulance.
The 20 minutes earlier?
Or gotten the ambulance there, who could have,
yeah.
Ambulances can go fast. We've all seen them rushing down the interstate.
Yes.
Like, I wonder if he could still be alive, or if maybe the meningitis was too far along that at that point he would have brain damage, because that can happen just leaving it untreated.
Yeah, absolutely. And like I mentioned before, another doctor also testified that the stiffening of Ezekiel's body and the gradual improvement with no appetite were all textbook signs of meningitis. So on April 27th, 2016, a jury found both David and Jaclyn Stephan guilty, and a crowd of 70 supporters were outside the courtroom the day of their sentencing, shouting their love and support for the couple. So a lot of people felt that they were unfairly accused. So David was sentenced to 4 months in jail, and Jaclyn was sentenced to 3 months of house arrest. So I'm not quite sure why the difference, because everything we've said up to this point, it's not like one parent it's not like he was telling her, it's not like she was telling him, oh, we should go to the hospital, and he said no, and they didn't play an equal part.
Yeah.
So I don't know if because she was the primary caregiver of their children, that they were like, oh, well, we don't want to put both parents in jail at the same time, so if we put you on house arrest, at least you can still care for your children. I don't know that. I did not read that anywhere. I can't find any reason for the difference in sentencing. That's just Jaclyn's thoughts and ramblings. I don't understand that.
That's a new corner. Jaclyn's thoughts and ramblings.
I'd be really good at that. So during the trial, both of them said that they would have taken Ezekiel to the hospital if they had known that this could be the outcome.
I'm sorry. You deep dive researched meningitis. You knew death was a strong possibility.
As a 7-year-old child who watched TV, I knew from commercials that death was a possibility with meningitis, and you did a deep dive research on WebMD where you learned all the symptoms of this illness that you believed your son had because your friend who was an RN and was also there for the birth of your son told you that this was likely. You had all of this information and you still chose not to. So don't say that you would have taken him to a hospital if you knew this was a possibility.
Hindsight's 20/20, but also, like, take your kid to the hospital if they're, like, literally laying there, unresponsive most of the time, won't eat, won't drink. If nothing else, take them so they can get fluids.
Yeah, you're using an eyedropper.
Dehydration can, like, really, really hurt people. Like,
exactly. If your child can't consume fluids to the point where you're using an eyedropper just to get fluids in them, that's a problem. That is a concern.
Which I also saw, I don't know if you'll bring this up, but I saw quotes later from David being like, people said that we were giving him like an eyedropper of liquid, and that's just not true. And I'm like, your wife literally told the RMCP that. Like, literally told them that. Like, what? Why are you lying?
Oh, yes. He says lots of things that then he's like, oh, this isn't... Or I saw one video where he's like, they said we gave him beetroot, and like he makes up some like obscure things. I'm like, okay, well, you didn't give him that, but you gave him fucking garlic and horseradish, so like it's the same thing. Like,
or extract or whatever it was. Like,
yeah, like trying to act like it's absurd. They're like, people said we did.
I didn't give him beets, but I gave him like olive leaf. Okay,
it's different, right? Like, don't call me a bad parent, because I. God.
Oh Lord.
So the Stephans appealed this conviction in 2017 to the Court of Appeals of Alberta. So they argued that the jury at their first trial was not provided with accurate instructions and that different instructions may have resulted in an acquittal. So they also said that the jury was provided with prejudicial and unnecessary information about Ezekiel's illness and death, and were not provided instructions on what information to consider and what actually legally constituted failure to provide the necessaries of life. So basically they were saying that there was too much medical information provided at the trial about all of his symptoms, and that prejudiced the jury against them. Yeah.
I'm sorry, I don't mean to laugh, but your child dies of meningitis, and they're like, oh, no, don't tell the jury what meningitis is. Just don't tell them.
Yeah, don't tell them all the symptoms that he had that we ignored, because that's not relevant to what happened.
Don't tell him what happened the 2 weeks up to his death. He just stopped breathing. We don't know what happened. Like, What the fuck is wrong with you? Also, I mean, okay, I get it because you want to have like a clear record, but you only had 4 months and 3 months on house arrest and you're appealing it?
Yeah.
To me, I'd be like, cut my losses, let's keep going.
Right?
Like, I
Like,
get
just
maybe
done.
it's a pride thing, but like, really? Like, anyway.
But, I mean, I guess it worked because only 2 of the 3 judges agreed with the conviction, which means they had the right to take their case to the Supreme Court of Canada. So the conviction was removed due to the legal technicality on May 15th, 2018, and the case was scheduled to be heard again by the Court of Queen's Bench of Alberta. And the retrial began on June 3rd, 2019. So now things get real fun. So during the retrial, I'm going to try really hard to keep this disdain out of my voice, but it's just probably not going to be possible. I'm sorry. So David and Colette argued that Ezekiel only had a mild cold and choked on mucus, and that he only died because the ambulance did not have the necessary equipment to open his airway. So they're saying that when he coughed up the mucus earlier and he was able to breathe then, that's what the only problem was. And if the ambulance had the proper equipment, that they would have been able to get this mucus out and resuscitate him, and that he only died because of the 8 minutes of lack of oxygen to his brain.
Okay, I agree. The ambulances should have had the necessary equipment.
100%.
But the ambulances wouldn't have needed that equipment if you would have taken them the first 911 call. The first time.
Or
like if you,
the fucking week before, maybe, also.
when your child was too stiff to sit in his car seat, which, I mean, car seats are kind of big. Like, they're not that, like, crazy.
Mm-hmm.
And maybe instead of putting him, like, on a crib mattress in your trunk, like, maybe you could have taken him to the hospital. When literally a clinic told you, take him to the hospital. Take him to the hospital.
Yeah, exactly. If those things had happened, then the fact, tragically, that the ambulance did not have the necessary equipment, which, don't get me wrong, is completely awful. I'm very glad they remedied that situation. Should never have been the case. But that should not have been the deciding factor if your decisions had not led up to that point.
Yeah.
But speaking of the car seat, so as you mentioned, David said lots of things that he's like, oh, this didn't happen, even though Colette's statement said otherwise. So he says that it's not true that he was too stiff that he could not fit into his car seat. He said that he simply looked uncomfortable in his car seat, so they chose to put him on the mattress in the back so he could lie down or move around and be more comfortable.
Or maybe 2 of you don't need to go to an office. One can stay home if he's that uncomfortable.
If he's that uncomfortable, why do you both need to go to pick up your Blastorama fake nutrient stuff, okay?
Your stupid hippie shit. Like, I hate to say that, but I'm just like, come on. Like, I understand people don't want to be taking, like, antibiotics for every cold. But there are, like, antibiotics are there for a reason. Like,
Yes.
we have vaccines and medicine for a reason. Like, there's no reason this child should be dead right now.
Yeah.
Like, honestly. And there's, like, no reason that children this age should die of, like, smallpox or measles. Like, we have vaccines for that. Like, just vaccine your kids. They're fine.
Yes.
They're not going to have trauma for it. Shut up.
Don't send us an email because we're not going to debate this with you. The end.
Yeah. I'm going to believe science, and if you want to come at me, like, go somewhere else because I ain't listening.
Yes. Period.
And vaccines do not cause autism.
Nope.
Just PSA, people.
And even if they did, autism is not worse than a dead child. But they also do not cause autism. So anyway.
Yeah. Having autism is better than dying from a very treatable and preventable disease.
Yep.
And there's nothing wrong with autism. And again, does not cause vaccines. Let's just say this 40 million times so maybe it'll get through everyone's thick skulls.
Vaccinate your kids.
Please.
The end. So, back to the trial. They also argued that the medical examiner was not qualified to testify about the cause of death, and that they had another expert testify that Ezekiel did appear to have a lack of oxygen to the brain, which may have been caused by the ambulance's inability to intubate him. So they're saying that he was not brain dead by the time that the ambulance arrived.
I'm sorry. A medical examiner literally went to medical school. Like, they went through training. They're a doctor. I don't care what little naturalist you brought in. A medical examiner is qualified to testify on the cause of death. That is their number one fucking job.
Oh, Courtney, you're going to be so mad in a
Oh my
minute.
God,
Okay.
that's their number one job. That is the one thing you do. You're a medical examiner. What do? I find cause of death.
Okay. Well, I'm glad we feel that way. But, unfortunately, so the trial was heard by Justice Terry Claxon, not a jury, just a judge. And on September 19th, 2019, the judge issued the following statement. Quote, "The evidence plainly establishes that Ezekiel had meningitis. The main issues in dispute are 1. Whether he had bacterial or viral meningitis. 2. Whether his death was the result of the meningitis or the hypoxic injury, which was the lack of oxygen to the brain. 3. Whether the Stephans knew he had meningitis. And 4. Whether knowing that they ought to have sought medical intervention. I have concluded that Ezekiel did have meningitis. The Stephans did not know that Ezekiel had meningitis, but were alert to the possibility and monitoring for symptoms. The meningitis Ezekiel had was viral, and he did not die from meningitis, but a lack of oxygen. Therefore, I have concluded that the Stephans are not guilty of the charge."
I'm sorry, excuse me, Terry. What?
So,
Where is your medical degree? Where is your medical Please, please, Terry, show me your medical degree.
it gets better. And by better, I mean worse. So, therefore, Justice Terry Claxon gave more weight to the testimony of the defense's medical expert, saying that Ezekiel died of lack of oxygen to the brain, not of meningitis, as the medical examiner, I'm sorry the name, I'm going to try my best, Dr. Bemidel Adiegbo had testified. So then the judge made the following statement in his decision regarding Dr. Adiegbo's testimony. Quote, "His ability to articulate his thoughts in an understandable fashion was severely compromised by his garbled enunciation, his failure to use appropriate endings for plurals and past tenses, his failure to use the appropriate definite and indefinite articles, his repeated emphasis of the wrong syllables, dropping his H's, mispronouncing his vowels, and the speed of his responses."
I'm so mad I've shut down.
Yes. Yes.
Like, I'm sorry, just because maybe he can't speak perfect English does not mean he's not an expert.
Uh-huh.
And I mean, I don't know if English was his first language or not.
It is not.
But the thing is, I assume. Sorry.
No,
But
yes.
the thing is, like, I don't know. I'm like speechless right now. Like, people do not have to speak perfect English. Like, there are plenty of different like dialects in English of where you grow up and how you're raised. I'm from the South, and sometimes I drop my E's and I say things that probably are not grammatically correct. That does not mean I don't know what I'm talking about when I'm like referring to something like I'm literally like trained in.
Exactly. Exactly.
Man, my blood pressure is going up.
I'm telling you. So dozens of medical and legal experts filed complaints against the judge with the Canadian Judicial Council, claiming that the remarks he made were racist and damaging, and indicated that he did not consider Dr. Adiegbo's testimony to hold the same weight as the opposing expert because he was difficult to understand due to English not being his first language.
Preach.
Like, I have no words. I have no words. Your inability to speak... Please, if you are an expert in something, I want you to go to another country and I want you to explain what you are an expert in their language, and tell me how many mistakes you make with your verbiage, with your syllables, with your dropping your H's, with being difficult. This judge literally said that he did not consider this man's testimony because he couldn't understand him. Just let that sink in for a moment. These people were acquitted on these charges because the judge could not understand the medical expert whose first language was not English. That's literally what happened. He wrote it very plainly in his decision that is why.
Yeah, basically because this judge is a racist. And I think it's a good moment to bring up. I do know a few people who live in Canada and do post that racism is very real in Canada. And I know Canada is a lot more forward than the U.S. in a lot of systems, but racism is everywhere. And we do need to fight racism everywhere. And just remember that racism is real, and it doesn't just happen like in the South, in America. It happens in Canada. It probably happens in Europe. It happens everywhere. And we need to take a stand and not let shit like this be acceptable, where you're literally a doctor. Like, you literally studied for so long and they completely dismiss you because you dropped an H. You didn't, I don't know, respond quick enough because you're trying to translate in your head. So yeah, please right now, like, whatever you think you're an expert in, whatever you feel passionate about, please go speak it in French or Spanish or whatever's not your first language, and tell me that when I ask you questions, you can respond like that. Mm-hmm. Like, no, even if English is your first language, I would not trust someone who's like asking them a question and they're just like da-da-da-da-da, like super fast, like response. No. Mm-hmm. No.
And this is also just proof that racism is not as simple as, oh, I hate black people. I hate people who are a different color than me. And that's not all racism is. Racism is not considering equal weight to the testimony of someone because they don't speak English as well as you would prefer. That is racism.
Yeah.
I guarantee you this judge wouldn't sit up there and say, I hate black people, but he's going to say, I don't consider your testimony to be valid and accurate, and I think that this child that I have no medical background, but I say he died of viral meningitis and the lack of oxygen to the brain, because that's what this white expert that I can understand said versus this black expert that I can't understand said that it was bacterial meningitis, which the expert, by the way, who actually did Ezekiel's autopsy, the other medical expert reviewed the records. He did not physically do the autopsy like this doctor did, and this judge is not considering his testimony.
Also, don't come at us about racism. We're not debating
Yes.
it. We're not gonna debate it. Don't come at us about vaccines or racism. These are two facts. If you don't want to believe it, that's not my problem, and I'm not going to read your email. It'll go in the trash bin.
We will have lots of conversations about lots of things. We are always open. We are usually open to opposing ideas and conversations. We will not debate or argue those two. Done.
Nope. Sorry.
So, back to Ezekiel. So, the Crown has asked the Alberta Court of Appeal to overturn the acquittal based on the judge's comments and perceived bias. So, the court was scheduled to hear arguments in June of 2020, and I can't find anything more recent than that. I couldn't find anything where it was rescheduled, so I believe it did happen. So, I don't know if they are still considering, if they are still making a decision. Maybe it was postponed and I just can't find a new date.
Especially because of COVID.
Yes, exactly.
So many things have been just kind of put on the back burner.
Yeah, so I did find some articles that were prior to June speculating on whether or not they would still have the hearing, but I haven't found anything since then. So we will definitely give you guys an update when we hear, but that's where it is currently. They are currently acquitted, but they are appealing it again to try to get them convicted again because basically they were acquitted because the judge is racist. So
yeah, and that's the thing is, I don't believe these parents were malicious. I don't believe they intentionally did anything, but also as a parent, it is your responsibility to take care of your child. It is your responsibility to take them to the doctor when they're stiff, when they're lethargic for 2 weeks, when they're not eating, they're not drinking. Like, that's your responsibility as a parent. And I do just want to remember Ezekiel because he was just so innocent in all this. And I just know the last 2 weeks of his life were probably just full of pain and just not feeling good. And it breaks my heart because all I want to do is just cuddle him, and his picture is so cute. And I wish I could take his pain away and not have any of this happen. And I wonder where he could be if he'd had parents who believed in science.
Yes, and like Courtney said, we don't think that this was there, and that's why I mentioned with the 911 call, it's like, clearly this is not a case of murder. No one's saying that they intentionally did anything to him, but we are questioning their decision-making abilities, and unfortunately, sometimes if you make a very poor decision, you have to be held legally accountable for it. Definitely let us know what you guys think. The vaccination topic is not up for debate, but if you do not think that they deserve to be found guilty of this charge, let us know. We are definitely open to that conversation because we do recognize that there is a point where parents are able to make their own personal choices for their children. we understand and respect that, there is also a point where you are legally neglecting your child. So.
Yeah, because I just think, too, I mean, I feel like I've even seen cases where, you know, you're just not watching your kid or you're not paying enough attention and you can still be found, you know, negligent or just child neglect is a literal charge in at least the U.S., like, especially leading to death. Like, I don't know, it's your responsibility as a parent to do everything in your power, in your means, to take care of your children.
And especially, I have a hard time because it seems like they had the information and the knowledge. It's not like they didn't have the RN check them at all and they're like, oh, I had no idea that it could be meningitis. They knew it was a possibility of meningitis. They were told to see a doctor by the friend. They believed
it was viral meningitis. Like, Colette herself researched and was like, yeah, I think it's viral meningitis. And she still chose to do it. And again, it's not like this is a little house on the prairie and she's 2 hours away from the nearest city and she lives in a population of 7 and 6 of them are their kids and one's random guy who shoots guns at bears. It's not like that. It's... Sorry, guys, my second rum and coke is hitting.
Courtney's in a spiral. This is another evening episode, by the way. Courtney's not drinking rum and coke at 10 a.m.
No, I am not. But it's you're in a city. You have very close. I mean, you're at a grocery store that has a walk-in clinic. Yeah. It's not like you're in the middle of the woods and you don't have internet and can't find out it's meningitis, that you had no idea, that you don't know what's happening, and you don't have the means to go somewhere.
Again, guys, remember, this is 2012. This is not a long time ago. I mean, this is so recent.
Yeah. That's what's baffling to me. Like, when I kept researching it, and I'm like, this was 2012. I was 18. I was graduating high school. Mm-hmm. Like, this is insane. Yeah. Like, what is happening?
So, like I said, let us know what you guys think about this case. Again, thank you so much to our listener and wonderful patron Sierra for suggesting this case and also giving us information to use for the sources. We really appreciate that. Courtney, what is your perk of the week?
Okay, my perk of the week is I voted.
Whoop, whoop.
So by the time this is out, we'll have a week to digest whatever the news is of the U.S. 2020 election. So hopefully, by the time this comes out, we will know the answer and America will have adjusted to whatever that answer is. But I did go vote because it is my right as an American citizen, and for the longest time, women and people of color have not been able to vote. And, you know, something my dad pointed out as well is, like, even when women got the right to vote, they still had to vote whatever their husbands told them. Like, you just did what your husband told you. So, you know, women fought so hard for the right to vote, and so I tried to always, every election, local, state, presidential, I try to vote because people did fight for that. And even now, I think there's still some voter suppression a lot. And so since I do have the privilege to vote, I'm always going to do that. And yeah, so that is my perk of the week. Jaclyn, what is your perk of the week?
That is a good perk of the week. I already voted a couple weeks ago, by the way, just throwing that out there. But
oh, gotta one up me.
No, I was like, if I say this whole other perk of the week, people are gonna be like, did Jaclyn just not vote? But early voting started in September here in Virginia, so I voted a while ago.
Some states don't have early voting as well. Like, you have to go on election day, so it just really varies.
Which Virginia did not pre-COVID, which Tennessee and North Carolina, the other places where I have voted, have always had early voting, which I really appreciate. But Virginia, in general, does not have early voting, and they only had it this year because of COVID. So...
And with early voting, it still took me an hour and a half to vote, which I've heard it's been like that every day. And I've early voted in the last presidential election, and it took me 15 minutes. Yep. So I'm really glad people are coming out to vote.
Yes, the numbers are insane right now, and it's wonderful. But I guess kind of sort of speaking of voting and the election, my perk of the week is that Andrew and I took a day trip up to DC this weekend. Nothing particular, just, you know, to get out of this area, and you know, we just hung out outside and walked around the monuments and went to this Italian restaurant where I got some delicious spaghetti that was amazing. And I also got, Courtney, I don't think I even told you about this, I got this bourbon pumpkin, like, bar thing. It was kind of like It's kind of like a pumpkin pie sort of texture, but then it had like a bourbon something at the bottom, and there was like some salty like aftertaste and like a dollop of whipped cream on the top. So I shoved my face with that while I was sitting in DC traffic on the way home, and it was delicious. So that was my perk of the week. Just some, and also I'm sorry guys, you know me and my food. So the spaghetti. So it was the spaghetti and meatballs, and I don't eat beef. I don't know if we ever talked about that, but I asked him if he could do a vegetarian spaghetti, and he was like, yeah. And he's like, do you want me to put mushrooms in it instead? And I was like, yes.
Can I marry you?
Right?
Yes.
I was like, oh, please, that is wonderful. And let me tell you, this bad boy was full of mushrooms. I mean, sometimes you get one that's like, oh, thanks, I got 5 mushrooms. No, every bite had mushrooms. It was fantastic, and it was homemade pasta. And it was delicious. And that's my perk of the week. The trip and mostly just the spaghetti and my pumpkin bourbon bar.
Yeah, Kevin and I went to DC like when we first started dating. So the first time we went back up to Baltimore, on the way back, we stopped in DC. And I remember the night before, it was after midnight, and we had walked like to like Fells Point in Baltimore, and then walked, I swear to God, like 3 miles back to his brother's apartment at like 3 a.m. because we're fucking idiots. But the next day we went to Washington, D.C., so we walked around everywhere, and literally with an 8-hour drive that day, I had 30,000 steps.
Oh my gosh.
But it was beautiful. It was so awesome to see D.C. and like see all the things like I'd only ever seen like on TV. So it is a really nice place.
City.
I want to go back.
Yeah. Well, it's only a couple of hours from us, so the next time you finally come see me, we can take a day trip up to DC again.
Yeah. Also, I've already decided, sorry guys, this is food corner. I've already decided when you come up for Thanksgiving, I'm going to make you like 3 pumpkin chocolate chip breads.
When you started that sentence, I was like, please say pumpkin chocolate chip. Please say pumpkin chocolate chip.
Because I was thinking like, I was like, she's coming up, and I was like, I'm going to have to make her like 4 runs of it.
Please do. Please do. I cannot wait.
I can't wait either, because Kevin won't eat pumpkin, so I don't bake anything with pumpkin because I'm like, I can't eat all this.
Yeah. Andrew also does not eat pumpkin, so Courtney and I have to eat the pumpkin together, and we've not seen each other this fall, so we can't eat the pumpkin together, and it's been rough.
Yeah.
But Thanksgiving is soon. It's almost here.
We're gonna have it.
We're gonna eat the pumpkins.
Do you like pumpkin? Tell us at Instagram at Caffeinated Crimes Pod, at Facebook at Caffeinated Crimes Podcast, at Twitter at Caff Crimes Pod, CAFF Crimes Pod, or send us an email telling us how much you love or hate pumpkin at caffeinatedcrimespod@gmail.com. And if you want to see a monthly Q&A of us eating pumpkin. Okay, sorry guys, I'm derailing. If you would like to support us, get some bonus content that will be a little bit better than this right now, get to see our faces sometimes. Get to see our faces in a like monthly Q&A, monthly Google Hangout, whatever. You can go to patreon.com/caffeinatedcrimes and support us there.
Yes, all of those things. Also, we were talking, I just imagined if someone just randomly tweets us, yes, I like pumpkin. Please do that.
And we're going to forget about it because we always forget what we say in recording.
Yes, very true, very true. Also, if you want to leave us a review, that would be delightful. And you can do that at Apple Podcasts. And once we reach 50 of those, one of you guys are going to get a $10 gift card to a coffee shop of your choice and a sticker and a pin. I don't know, maybe Courtney will throw in some pumpkin chocolate bread. Let us know if you guys like it. Leave us the reviews. We'll see.
You can get a gift card and get a pumpkin spice latte or a pumpkin cream cold brew or a pumpkin coffee at Dunkin'. There you go.
Makes more sense to tie it in than Courtney making you bread. So
I might make you bread. I love you guys. Whatever you want. Come on over. Come to Aunt Courtney's house. I got you.
So do all of those things.
Yes, and go have a cup of coffee.
And don't commit a crime.